Hello, my name is Quenisha Maize, and today I will be discussing my teaching project, which is Infection Control and Disease Prevention of C. diff. I work in acute care, and my project is needed because nurses are taking care of these C. diff patients, and they're just not using the best methods. So I chose to use lecture as my teaching strategy. And it's important for me to use a lecture with my nursing staff because I feel like it's the most effective way to learn, and information is just retained easily through a lecture. So let's just get started. The goals are prevent the spread of C. diff by maintaining proper hand hygiene each shift, educate the patient on the treatment of C. diff on admission, designate disposable medical equipment for each C. diff patient in their room, don the proper PPE when entering the C. diff patient's room. Our objectives are, by the end of the presentation, staff will be able to maintain proper aseptic technique when providing care to C. diff patients, identify 2 or more lab values that need to be monitored with no errors, assess skin integrity for breakdown while performing a physical assessment, and evaluate stool for the presence of blood by performing a hemoccult test successfully. What is C. diff? C. diff, also known as C. difficile or Clostridioides difficile, it's a bacteria that can cause severe diarrhea and colitis. It's bacteria that lives in your gut that can cause infection. It is transmitted via fecal-oral route, and C. diff is the spore-form bacteria that can spread easily and can only be removed from hands by using soap and water. Symptoms of C. diff. We have severe diarrhea, defined as 3 or more stools in 24 hours, fever, nausea, abdominal tenderness or pain, loss of appetite. Some things to do or think about before you test. Does the patient have any other factors that can cause diarrhea, such as the use of laxatives, stool softeners, recent C. diff diagnosis? Have they just started tube feedings, or other disease processes? You want to assess your patient daily and huddle with the charge nurse before sending any specimen to the lab. Some C. diff misconceptions. C. diff does not have a particular color. It does not have a certain type of smell. You should not test C. diff based on smell. C. diff isolation procedure. So the procedure for a C. diff is enteric precautions. We do that by cleaning our hands, by washing when entering and exiting the room, gown and gloves at the door, use patient dedicated equipment or disposable equipment, display the sign outside of the patient's door on their room. Dishes and utensils, we just send those down and they are handled through the kitchen in the dishwasher. They get sanitized that way. There's no special handling of them. Linen management, you just bag your linen at the door. And personal protective equipment or PPE. The proper donning of that is as follows. You're going to wash your hands. You're going to put on your gown, your surgical mask if needed, your eye cover if needed, and gloves. And then the removal, you're going to remove your gown and gloves, the eye cover, the surgical mask, and you're going to wash your hands. Transport of the patient is just making sure they are clean whenever they are transported, and making sure that gown is clean as well. You don't ever want to use alcohol-based hand sanitizers. C. diff can only be removed from the hands by using soap and water. You want to place a sign on all the alcohol-based hand sanitizer dispensers in the patient's room, just as a reminder to not use it. Some of the lab values that we want to watch for when having a C. diff patient are those electrolytes, such as potassium and magnesium. You also want to monitor their WBCs and the BUN and creatinine, because we know they're having a lot of diarrhea and just want to make sure they're not getting dehydrated. So my conclusion, in conclusion, C. diff is all around us. It's everywhere. It's spores, as we have learned through this presentation. And we as nurses, we just have to do those things mentioned in this presentation to make sure that we are adequately taking care of our C. diff patients. We just want to provide the best care for them always. Thank you.